This video is about how to manage a complex macular hole. A young man after blunt trauma presented with full thickness macular hole. His pre-operative visual acuity was 20/100. A 23 gauge pars plana vitrectomy with internal limiting peeling and gas was planned. After tricot assisted posterior vitreous detachment induction, brilliant blue-green dye was used to stain the internal limiting membrane. Finesse loop helps in safely creating an edge to lift the internal limiting membrane. Multiple ILM flap inverted over each other using a small drop of viscoelastic over macular hole. Followed by passive air fluid exchange to stop slippage of the flap and using 14% C3F8. The eye was closed and 1 month post-operatively the visual acuity improved to 20/40 and the macular hole closed. Thank you.